Hello friends, this is a case of pig bite injury, and this injury, if you see, this is at the region of the sternum. So from here, so from the outside it looking like it is only subcutaneous, but when we enter the finger, so it is going deep, and ultimately it is opening into the, somehow it is connected to the thoracic cavity. So from here, air is basically going into the thoracic cavity, and you could see here, so there is a problem in the respiration also. On radiograph, we could see that there is a presence of the air inside the thoracic cavity, and the lungs lobar, they are retract, and there is a increased opacity of the lungs. If such type of bite you could see notice in the this sternum region, or at the level of the thoracic inlet, or in the neck region, so you always go for the radiographic examination and then see whether the pneumomediastinum or pneumothorax. So in general, the pneumomediastinum, if it is severe, so it may lead into the pneumothorax, but in this case, since it is injury in the this cranial region, or at this point, so from here the air also entered into the mediastinum as well as in the pneumothorax. Otherwise, if there is no such injury, only injury in this neck region, so in that condition, so first there is a pneumomediastinum, and from the pneumomediastinum then it enter into the thoracic cavity, or in the pleural space, and cause the pneumothorax. So pneumomediastinum can cause the pneumothorax, but pneumothorax never cause the pneumomediastinum. And now we are going to tubate, and then with the help of the this machine, this inhalant machine, we inflate this lungs completely, so that whatever they are present in the thoracic cavity, that will escape through this wound, and then simultaneously we close this wound. Although this is the 3 or 4 days old wound, so this is the reason that we applied here the nylus suture, that is the polyamide suture material. So now you could see we prepared this site. Although this is the infected wound, it is 3 to 4 days old, so definitely we consider it as a infected wound. So here, if I am putting the finger here, so the wound is here in the thoracic cavity here basically. So we have to extend the incision in this fashion here. It is a bite wound, so from the outside, or outside is looking like that it is a very small wound or narrow, but on the inside it is a big wound. So here our intention is to just to reach the wound which is open into the thoracic cavity, and we'll try to close the so we have to extend the incision further here. So now you could see this one, this is the opening. This is the opening from where now you could appreciate this opening. This is the opening which is going, now you could see. So this is the opening, this one. So for this, so we have to place the first pre-place the polyamide thread. So this one is the sternum. From sternum you can say this rib has started, so we pass circumcostally, means taking the rib here and here, and we first pre-place the thread and then we pull, and at the time of pulling we ask the assistant to inflate the lungs completely so that we can create the negative pressure inside the thoracic cavity. It is very difficult to show this all interruptibly, so here I am taking a pause, and after repair then I will come back. We have pre-placed the two cross mattress suture, so we will pull like this at the time of inflation of the lungs. So now you could see, so we have placed the two suture to close this opening into the thoracic cavity. We will further, you can say, reinforce this one with applying these muscles with this, and then we will apply the figure of 8 suture pattern since it is contaminated. So initially the wound was here, so but we extended like here and here, so we prepare this skin along with the subcutaneous structure and muscles in a figure of 8 pattern using the nylon suture. So you could see this is the, so now you could see the animal is respiring on its own, means we have removed the ventilator, and now you could see, so there is no escaping of the air from this area. So this is how we manage this case of the puncture wound into the thoracic cavity. So thank you very much for watching this video.